Can storms create more aches and pains? Does the temperature drive the impact of flu and cold season? Questions like these that tie weather to our health prompted Cassie Wilson to talk to some medical experts to find out what is fact and what is fiction.
You can escape the cold by moving your exercise inside, but you can't always escape those aches and pains. When it comes to the weather, feeling those changes in your body comes down to one main thing:
barometric pressure.
Weather, and when it does get colder, there is a shift in the barometric pressure. That barometric pressure has been shown in some research to cause decreased blood flow to the areas.
But what does blood flow have to do with the pain we experience in our joints? Dr. Eric and Dr. Jenna of Identity Chiropractic explain that healthy blood flow is an important factor for joint mobility.
Our joints and tissues and musculature thrives on that because our blood actually brings some nutrients and oxygen to that area to keep it healthy and feeling better.
So anytime that the weather gets colder, you're going to notice that things start to ache a little bit more, things feel stiff, things feel tighter than they normally do because you're just not getting that circulation that you normally do.
Not everybody feels barometric pressure the same. If you have chronic pain or if you've had surgery, you can be more sensitive to changes in barometric pressure. With my surgery punch card sitting at 8, I can tell you that I can forecast the weather and I can feel it too. So moving your body can help, but what else can you do?
The number one thing to do when it is cold and your joints ache is to get moving. Increase blood flow, get those nutrients to the tissues, stay active as much as possible. If it is something that's really bothering you and you feel like you need extra help, find a great practitioner in your area, whether it's chiropractic, physical therapy, massage therapy, anyone that can kind of educate you on movements.
But it's not just barometric pressure that impacts our health. New research shows that cold air impacts our body's ability to fight off colds and flus.
There was a large paper published December of last year, which did show that temperature changes going down into the 40s or 50s or even colder can change some of that immune response in your nasal passages.
Humidity also plays a role in helping spread pathogens. Dr. Hawkinson explained that respiratory droplets can spread easier through humid air. But he also cautioned that while the weather plays a role, our winter cold and flu season is really all about human behavior.
In warmer climates, equatorial climates, do things change, and that doesn't really happen. Those areas still have their seasons, still have high circulation of the virus. So again, I think it's less about the actual temperature and humidity, and it's more about people getting together, because in those areas you're still going to have increased circulation of the virus, particularly if people are traveling to and from different areas. So they will bring the virus with them.
It's having the kids back in school, traveling for the holidays, meeting indoors versus outdoors. Those behavioral changes are what stir up cold and flu season the most. So what can you do to protect yourself?
Hand hygiene is going to be the first one, right? That's your personal thing. Prevention, obviously vaccines, but certainly hand hygiene is going to be vitally important.
So here's to staying healthy this winter, no matter what the weather throws at us. Reporting from the KSHB 41 gym, I'm meteorologist Cassie Wilson.